So first special test for hip, we're going to do hip scouring. So I'm going to fully flex their knee and their hip, throw it over my shoulder, intertwine my hands, push down on their knee, push down, and then do internal and lateral rotation. And we're looking for any sort of pain, which would be indicating a labral tear, labral pathology. Torque test, I'm going to have my patient sit with their leg hanging off the table, right here, put my fist under the calf, and apply a downward pressure. He would be sitting up, but he's recording. That would be any pain in the femur or on their thigh would be indicator of a femur stress fracture. 90-90 straight leg test. I'm going to have you flex both your legs, and I can take I'm going to have you put both your legs up like that. Now flex this one up, down, and then do the other one, and then down. We're looking for any sort of, you can put your legs down. For a 90-90 straight leg test, we're looking for full extension in the legs, but he didn't fully extend either of them, so that means tight hamstrings. Patrick Faber test, I'm going to have you put this leg straight, and then I'll have you put this heel, I'm going to make a 4, and then we're going to kind of see, it should technically drop, but he's trying to compensate with his hip coming down, so little tight IT band. Can you pause it? Patrick Faber tests, like I just did, we're looking for if the knee remains above the opposite leg, so I would test on the opposite leg too, and then if one knee is lower than the other, then the higher one would be an indicator of SI joint involvement or IT band tightness. Burst test, I'm going to have my patient stand up in front of me and tell them to stand on one limb for 10 seconds, stand on one limb, and then pretend it's 10 seconds, and then switch. And then if their pelvis on the unsupported limb drops, this would be an indicator of weak gluteus medius or hip instability. For Ober's test, I'm going to have my patient on their side, so he's on his right side, and then I'm going to abduct and extend their test hip, and then allow their knee to lower. If they are not able to abduct or lower the leg, or adduct, it is an indicator of a tight IT band. For piriformis test, I'm again have them on their side, and then have their legs stacked on top of each other, and then I'm gonna have the top knee slightly out, and I'll be standing behind him. I'm gonna put one hand on their pelvis, and then one hand on the top of their knee, and I'm gonna apply the downward force to their knee, and you can't really see it right now, but if there's any tightness or pain in the hip or the butt, this would be piriformis syndrome. For Thomas test, I'm going to have them put your butt on the edge of the table. So go ahead and pause it. Thomas test, I'm going to have my patient put their posterior superior iliac spine on the back or edge of a table. For this we have a bed. And then I'm going to have him grab his knee and then just lean back. Not too far, just a little bit, just enough. And then, so lack of hip extension with knee flexion greater than 45 degrees would be a psoas tightness. Full hip extension with the knee flexion less than 45 degrees would be an issue with the rectus femoris, or a lack of hip extension with knee flexion less than 45 degrees would be both psoas tightness and rectus femoris tightness. So we've got our anterior superior iliac spine, umbilicus, belly button, McBurney's point, which is asis and umbilicus, and then the midpoint, which would be appendix, and then the SI joint, which is on their back where their pelvis is near the sacrum. So what I just did was pelvis palpations, and now I'm doing special tests for pelvis. First special test would be measuring for true length. So measuring for functional leg length would be measuring from the umbilicus, the belly button, to his medial malleolus down here. But for true length test or true length measurement, I would measure from the anterior superior iliac spine to the medial malleolus. And there would be a side-by-side difference of more than 1 centimeter, if there were a side-by-side difference more than 1 centimeter, that'd be an indicator of leg length discrepancy, where one leg is shorter or longer than the other. For gapping and compression test, I'm going to can you pause it? Gapping compression test. I'm going to put opposite hands over anterior superior iliac spine and then apply a downward and outward pressure. And then if there's any pain in the SI joint or gluteal region, this would be SI dysfunction. For long sit test, I'm going to have my patient laying supine, so he is right now. And then I'll grab both of the malleoli and pull their legs out. Look at the positioning of the malleoli with my thumbs to see if one is longer or shorter than the other. And then I'm going to have my patient sit up and look at the malleoli again. Just go ahead and sit up. And then if the injured leg was longer than the supine, when they're supine, and then becomes shorter when they're sitting, this would be an anterior rotated ilium. And then if their injured leg was shorter when they were laying down, and becomes longer when they sit or sit up, it would be a posteriorly rotated ilium. So longer or shorter is an anterior rotation, shorter longer would be posterior rotation. And then McBurney's test, I'm finding for pain with rebound would be an indicator of appendicitis, and like I said, I would find anterior superior iliac spine and then umbilicus, and then find the midpoint between them, and then apply pressure, looking for pain with rebound. When I remove my fingers, indication of appendicitis. That's it.